Well, good morning, everybody. It's great to be here. And as I was watching the introduction and seeing that timeline that Kelly presented, it really struck me that we wouldn't all be here if it wasn't for her determination, her hard work, and her vision for Kirk, and so I really would like to recognize that. And she's giving me a dirty look, just saying. So I'm going to talk today about our qualitative longitudinal study, and you'll recognize some of the names on this slide with me. This was a larger study which was done with men and women, but I'm just going to focus on the analysis of women today. And I'm going to start off by just showing you a model of disability that we developed a few years ago when we started to become very interested in aging with HIV, and we thought we needed a model to really start guiding our research. And what I'm going to just point out here is that in the center of all this is uncertainty with aging. We actually developed this model with 49 men and women living with HIV, did extensive interviews with them, developed a preliminary model, and then conducted a number of focus groups to get feedback on it. And they told us what was in the center of this disability was really this uncertainty related to aging. It affected their symptoms and impairments, it affected their day-to-day activities, and their challenges to social participation. The other thing I want to point out here, there's also contextual factors. We know the environment's really important, and personal factors are really important in determining the amount of disability that you experience. But this whole issue of time came up, and you'll see some of the elements around there. And time is really important to think about it when you start to study and try to understand episodic disability, which fluctuates over time. And so we realized that if we want to understand this episodic disability, we just can't look at it cross-sectionally at one moment in time. We have to look at it over time. And that's what really led to this current study. And the purpose was to examine the disability and associated uncertainty experienced by older women living with HIV over time. And this was a longitudinal qualitative study, and I give thanks to Stephanie Nixon because we've done some similar work in Zambia, and this was her one of her brilliant ideas. We did semi-structured interviews based on the episodic disability framework. There was 10 women that we interviewed, and we followed them over a year and a half. And I'm not going to spend a lot of time talking about the analysis other than to say it's very complex because you end up having to analyze each individual and each cohort over time. And at one point in time, the bottom line is you get lots of data, and I'm going to be on research leave in the next, in a couple of weeks, and I have lots of data to focus on. So the participants were 10 women, and you can see some of the demographic data here. Importantly, although there were only 10 women, all women completed 4 interviews. So we're talking about 40 interviews. That's a lot of data. And it is thanks to my very able research assistant, Nicole, that she managed not to lose any of these women over time. It's really quite amazing. So the results, 2 main things. Living with multiple and complex sources of uncertainty, these women were certainly, as we looked at them over time, started to really appreciate what they were living with. And then we also learned about how women were dealing with that uncertainty over time. So first of all, just going to focus on the multiple and complex sources of uncertainty that the women were dealing with. And I'm just going to talk about these in a little bit of detail. So unpredictable health challenges. The women told us that they deal with fatigue, pain, insomnia, cognition, mood changes, and they really were unpredictable. There were fluctuations not only on a day-to-day basis, but sometimes over weeks and sometimes over months. And for some women, their fears of getting seriously ill when they worried about their health challenges were such that they chose to stay indoors, but particularly in the winter months when they feared getting the flu or the cold bug. And many of these challenges really, the benefits of this study was they were revealed over time. We wouldn't have seen these if we just studied these women cross-sectionally. Women worried about their cognition. Of course, they were aware of normal aging-related changes to cognition and memory, but they were very concerned about HIV-related dementia. And in fact, over the course of the study, 2 women were actually diagnosed with this over the course. And so it, again, led to lots of uncertainty and stressors for them over time. One thing that we just did not anticipate was the effect of weather. And it was really, we were quite astounded. It was a surprise to us. And then we had to think about, what's the context of this study? Well, this study occurred, you remember, over a year and a half, during what in southern Ontario they called the polar vortex. Now, I have to tell you, I was born and raised in Winnipeg. I have some colleagues here from Winnipeg, and it was not a polar vortex, just telling you. Regardless, the cold weather really was really impacted people's pain, their mood. It affected their mobility. There were cheaper forms of transportation, exercise, such as walking and cycling, were curtailed. They worried about going outdoors and actually falling. So the weather became something that was really unpredictable and really affected their ability to participate. Unfortunately, you know, I've been working in this area for about 20 years, and it's kind of disheartening to really see the level at which stigma and disclosure is impacting the participation of these women. So stigma due to gender, race, age, HIV status, sexual orientation, it really was a huge influence on these women over time. And for many, they chose to limit their circle of disclosure, still seeing that they are not disclosing to their close family members, really limiting their supports that they can access, and often leading to social isolation. Women were worried about whether they would have the ability to fulfill some of their gendered and family roles. Although the women were older and had older children, many of the children lived at home, and they still worried about providing meals and doing laundry and looking after their children. And many also looked after grandchildren or extended family members' children. And they did worry about being able to fulfill those roles and some of the uncertainty associated with that. I just noticed there's a slide missing because one of the other themes was maintaining housing and adequate finances, and I guess it's probably not any news to this group, but worth saying that many of the women were in precarious employment or underemployed or on disability, and so finances and being able to maintain their housing, the uncertainty of that certainly was a factor. So the second theme related to dealing with uncertainty over time. And we found that the women were really in 2 camps. Some of the women really tended to withdraw and limit their activities and participation when we looked at their progress over time, and others were more involved in engaging in meaningful activities. And for those who were withdrawing and limiting their participation, these women tended to limit their disclosure. They really feared getting ill. They were reluctant to burden their families and friends. These are the women that winter weather really influenced, and the overall picture was one of increased social isolation. In contrast, there were women who thrived over time, had a positive outlook, they really had a sense of purpose, they described lifestyle changes, and for me it really illustrated, again, the importance of looking at these women over time. One of these women at time 1 and time 2 interviews was very despondent, appeared very depressed, and then by the end of the study, she said, I've learned I've had resilience. And so what? So this really reinforces our initial model whereby we looked at that uncertainty and worrying about the future that was in the center of our disability model. And for me, it really helped us to understand more intimately their experiences by looking at it over time. It highlights to me the importance of the effects of stress and the need to really think about this in all our rehabilitation approaches. We know that the women are experiencing high levels of uncertainty and stress. We know that stress may accelerate cognitive aging in people living with HIV. 30 seconds. I was the only one last time. I'd want to notice I started first last time, and I was the only one of the whole group the whole day that went on time. So I now feel that I should be allowed to have my extra minute and a half. We know, I think important to know in the general aging literature, there's an association between anxiety and mild cognitive impairment. And so really reinforcing the importance to us of thinking about how do we integrate approaches to management of anxiety and stress through exercise, mindfulness, etc. The uncertainty of weather affects mobility and social participation, and I started to look at the literature related to this because I wasn't aware that there's actually some literature in the general population related to this. So thinking about weather as a risk factor for social isolation, we know people aging with HIV are at increased risk. And so I think it's important for us to be able to assess that as in our health and social service provision. And of course the need to increasingly to retain our focus on managing stigma. So I include this final slide. This message, I think, isn't, it's obvious, I think, to this group here, but I do tell my graduate students when they're presenting, they always should reinforce the rehabilitation approach and include a slide like this, because people don't know about rehabilitation, so always include one of these slides, even if you think your audience knows about it. So reinforcing of course, the importance for an interprofessional approach to rehabilitation and client-centered care. We talked about this morning, person-centered care, I call it client-centered care. It means different things for different people. But I think really important, I think the rehabilitation research would really support that this is important. It might not be for all, you might have to think about it differently, but it is a foundational aspect of rehabilitation. And self-management approaches, we've heard a little bit about that this morning. I know we're going to hear more about it today. Really important because not everybody who can get access to rehabilitation, and so we need to help them with providing some self-management approaches. So I'd like to acknowledge my funders, and thank you very much.